Welcome to Marina Hills Animal Hospital staff meeting. We're going to have our medical moment today on parvovirus. Parvovirus first emerged in dogs in the 70s, and when it first broke on the scene, there was no vaccine, and lots and lots and lots of dogs died of parvovirus. The good news is that today we have excellent vaccines that protect dogs against parvo. Parvo is unique among viruses because it is a virus that can live in the dirt, in the sunshine for 6 months, which is crazy. Most viruses, if the sunshine finds them, they dry up and they die. The implication of that is that any environment where a sick dog has been is a risky environment for a dog that has not been vaccinated against parvo. Again, the vaccine is excellent, but if your pet is under or non-vaccinated, it is at extreme risk for a really bad viral infection. The way that dogs with parvo present themselves, the way they appear, again, they're typically young, under, or non-vaccinated. The virus, dogs ingest, say, 10 particles, but the virus multiplies in the lining of their intestines, destroying the lining of their intestines, and they poop out bloody diarrhea with 10 million particles, which is why it's so bad, because it multiplies in communities and environments. At the same time that the virus is stripping the lining of the intestine, it suppresses the bone marrow, depressing the white blood cells, which are the very cells that would help fight infection. After the virus does its work, then the bacteria of the intestine, if blood is entering the intestinal tract, that means bacteria can enter the bloodstream, and so these puppies, these young dogs, get a secondary bacterial infection on top of their viral infection. And because these are dogs that often did not come from a mother that was well cared for, often the dog who gave birth had poor antibodies against parvo, and or they were not well cared for prior to giving birth, they may well pass parasites onto their puppies. So these young dogs frequently have parvo plus something else. Coccidia, giardia, roundworms, they get secondary bacterial infections. What's interesting about parvo infections is that sometimes really healthy pups get it and they have a very mild case and they get a little loose stool diarrhea and it's a very brief infection. However, more commonly, because they were maybe malnourished to start with, they had other infections before they got the parvovirus, it can really make them quite ill. And even with aggressive supportive care, IV fluids, antibiotics, antiemetics, acid blockers, drugs to treat concurrent parasite infections, even with all that supportive care, sometimes puppies die from parvo. So the key concept is vaccinate. That's the way you manage this whole thing. Puppies should get a series of vaccines starting at about 8 weeks of age. They get a booster every 3 to 4 weeks until they're 4 months old, 16 weeks. That is the key to preventing and avoiding parvo. Number one. Number two is if you have a puppy who is not yet 4 months old and fully vaccinated, avoid locations where parvovirus might be. That's any place that has high dog traffic. I always tell folks animal hospitals would be a terrible place for puppies if we didn't do a good job of cleaning and disinfecting. Here at Marina Hills Animal Hospital, I promise we do a great job. And that's all you guys in the room, by the way, that do a great job of disinfecting. But who's disinfecting the parking lot in front of the local pet shop where the shelter rescue groups bring their puppies to find them homes? It's not happening, and unfortunately that virus can live in the dirt in that parking lot for 6 months. And so I would recommend don't take your puppy to the pet shop. It's a really bad idea. If your pet has poor appetite, vomiting, diarrhea, get them to a vet. We have tests that can tell us very quickly if a case of diarrhea, vomiting is parvo or not, and then we can start treatment right away as soon as possible. So that's the basics. Any questions about that? Parvo, we just had a parvo puppy. How long are they contagious? The question was how long are they contagious? So after pets have recovered from their infection, meaning they're no longer vomiting, they have firm stools, then we mark on a calendar 30 days and expect that they will no longer be shedding the parvovirus after 30 days. But the thing you have to remember, if this was your house where this dog had parvo, there are a bazillion million copies of that virus wherever that dog defecated. So you need to be cleaning to the same degree that we clean in an animal hospital. And frankly, that's a really hard thing to do at a house. You may have noticed that our animal hospital does not have carpet. There's a lot of good reasons for that, but one of them is parvo. Because clean, hard surfaces can be cleaned and disinfected, but soft, porous surfaces cannot. In the backyard, you can use bleach. Bleach will kill parvo if you take household bleach and dilute it 1 to 10. Or is it 1 to 32? 1 to 32, not that strong. 1 to 32, you can kill parvo on a clean surface. But the thing to remember is, I'm talking about disinfecting. Disinfecting is different than cleaning. If you spray a turd with bleach, it's still a turd. If you want to disinfect, you need to clean up the poop first and then disinfect second. So disinfecting is a two-step process. You guys know that. Any other questions? So the answer was a month.
When can they be around other dogs?
So
is that a good idea? A month?
If they're shedding virus for a month, they should wait a month before they're around other dogs. And the other dogs should be adult, healthy, well-vaccinated dogs. It's really not the dog that's the risk, but the person who raised the puppy that had parvo. If that person walks in dog poop, even microscopic dog poop, and then walks over to a friend's house who has a puppy is not fully vaccinated, they could easily be transporting parvovirus on their shoes. So you need to think of it not just as the dog, but as the whole outbreak, and draw a circle around everyone and everything that's been exposed to that virus. Needs to be cleaned and disinfected before any young, non-vaccinated dogs encounter that dog, that family, that backyard.
And you still vaccinate a puppy that's had parvo?
Yes. When they're well enough to be vaccinated. Okay, good. That's the scoop.